So much awareness have been created about the blood group compatibility, and a lot of people already know who they are compatible with, the type that you get married to, and those that you cannot get married to. But the question now is, I don't really know the reason why awareness are not being made about the ratios. That is the positive or the negative sign that comes with your blood group result. When you go to the hospital and do your blood group check, you will notice that when the result comes out, you either be positive or negative. Either if you are A, B, O, there must be a positive sign or negative sign that comes with it. That positive or negative sign means something, and that is your ratios, and you must be aware of it, because it's also another important factor that you have to consider before getting married to anybody or before even giving birth. It is very, very important. I don't know if it's because it can be managed. That's the reason why a lot of people don't say anything about it. But it is always important that you know what you are getting yourself into, because when you are aware of something, it will help you to be able to prepare for it, or prepare for anything that will come out of it. So the before we start the video Before we start the video, welcome back to my YouTube channel. My name is Peace. If today is your first time of coming across my YouTube video, you are welcome. And if you're a returning subscriber, I want to say very big thank you so much for always coming back to watch my YouTube video. I really appreciate. God bless you so much. So without wasting much of our time, let's just go straight into the video. So what is Rhesus blood system? So this particular blood blood group system, it is referred as an antigen that is present in the red blood cell of an individual. It is not present in everybody's red cell, but it is present in some people's red cell, and that is when you see the positive sign. When you see that positive sign, it means that this particular antigen is present on your red cell. But when you see the negative sign, it means that you don't have this particular antigen on your red cell. And that's when it comes to blood transfusion, it is also considered, because you have to check it to know if this person is compatible with the patient you are about to transfuse that particular blood into. And when it comes to giving birth, it's also considered, because it after the mother's first child, it's also important that this person knows their blood group the rhesus system before uh, the delivery date. Yes, so it's important in terms of during pregnancy and during blood transfusion. It's always important for you to know your blood group system. So, and it's part of the blood group system. Both the ABO and the ratios, they comes together, because when you do your ABO blood group, you see the rhesus factor also is also done at that particular time, because when your result comes out, it comes out with the ratios, but people don't pay attention to it. I don't know the reason why. So the next question now is, how does it affect marriage? How does this rhesus affect marriage? So before you say yes to that particular guy, or you as a guy, before you even propose to the lady, make sure that when you are going for your blood group check, you have to check to know if you both are compatible as well in terms of the rhesus side. Reason is because if you as a man is positive and your woman is negative, you need to be aware that your woman is negative, so that you can take the necessary precautions when she puts to bed, or maybe if there is any kind of miscarriage, the necessary precaution can be taken so that it will not affect the subsequent pregnancies. So this is how when you want to get married to somebody, you need to be aware of this particular um, factor, so that you don't make mistake or regret anything in the nearest future. So how does it relate to mother and child? This is the main reason why people need to be aware of this factor, this rhesus factor. This is a major reason why you need to be aware of it. If you as a woman is getting married to a rhesus positive man, and you as a woman is rhesus negative, it means that your husband to be or your husband has this antigen in his red blood cell, while you as a woman don't have it on your red cell. So it means that you people are not compatible, but it can be managed. That is the reason why I think people are not scared of this particular one. They pay more attention on the ABO than the ratios. So if as a woman you are pregnant, your first pregnancy, and you are rhesus negative, during delivery, or maybe you have a miscarriage, there's possibility that the blood of your child, which might be rhesus positive, because if you as a woman get married to a rhesus positive man, most times there's chances that those babies used to be rhesus positive. So if the baby's blood mix with that of the mother, thereby the baby's blood going into the mother's circulation, it will go and sensitize the mother's antibody, building them up, which will make this thing, it will not affect the first pregnancy. It, like, normally it, the first one always, will always come out fine, but the subsequent one, maybe the second pregnancy, it will start affecting it. So when this blood enters into the mother's circulation, it will go and start building the mother's antibody to fight against the next baby's antigen. So let me break it down so that you understand it. When the mother gives birth to the first child, or maybe the woman had a miscarriage and she is not aware that, okay, she is negative and her husband is positive, and she decided to just move on with her life. So the baby's blood will go into the mother's circulation, that is going into the mother's bloodstream. When it meets, it will go and make the mother's antibodies to start building up. This mother's antibody will build up and wait. It will not affect the first pregnancy. But when the woman takes in the second time, this, and if it's rhesus positive as well, the mother's antibody will now see this baby as a foreign body. It will see it as a foreign substance, thereby fighting the baby's antigen. So when this happens, it will either cause the mother to start having miscarriage, or it will cause what we call hemolytic disease of the newborn. So it's always important that you know your rhesus factor before you say yes, you want to marry this person. So the next question is, how can you manage it? How can you manage this particular situation? You don't need to be scared. So sorry for the noise at the background. So back to the video. The next question is, how can this be managed? You don't need to be scared because the condition can actually be managed, but you can only manage a situation that you are very much aware of. So if you're a rhesus negative mother and your husband is a rhesus positive, when you take in your first pregnancy, it is advisable that you should be close to your doctor, because they are the ones that will manage this situation. So they will administer a drug known as Rogan, and this drug, the first shot to be given to you at 28 weeks of your pregnancy. Then the second one will be given during after deliveries. It should be given 72 hours immediately after delivery. You don't need to waste time. The highest you can stay is 72 hours. They should administer the second dose to you. So when this drug is given, it will now prevent the antibody antigen reaction that might occur. It will now prevent this particular subsequent miscarriage, or your antibody fighting the antigen of your baby. So the next question now is, what is rhesus sensitization? it's the same thing with the one I said before. When you hear about rhesus sensitization, is when a mother's when a mother, when a woman give birth to a rhesus, when a mother's antibody has already been sensitized, thereby fighting against the child antigen. This particular sensitization will now make the mother's body to start seeing the baby as a foreign body, and it might cause some women to start having miscarriage. Some will end up not having any other child because their body has already been sensitized. And one thing you should know about it is that the moment you are sensitized, there is nothing you can do about it again. So you need to be very careful and be aware of what you are doing. So other things that can lead to sensitization of the this thing, this protein, the antigen, is it is not only when a woman give birth. Maybe when during blood transfusion that you transfuse the positive to the negative without knowing, transfusion can cause blood transfusion, miscarriage, and ectopic pregnancy. So but when you are aware of your rhesus factor, you will always take the necessary precautions immediately. So it's always important for you to know it. Don't just ignore it. Don't say plus sign, I don't know the meaning of it. You have to ask your doctor what's the meaning of the plus sign or the minus sign. So I'm not telling you today that the plus sign means that you have this antigen present on your red blood cell, and the negative sign means that you don't have the antigen present on your red blood cell. So then the next thing you have to know about this is that you shouldn't waste time about your drug, the Rogan. Make sure, for those of you that always say I won't go to the hospital, it's always important for you to always go when you are pregnant, go to the hospital to know the necessary things that you need to do. So without, let I think this is the little I can inform you about this ratios uh, blood grouping. So if you have any question at all, you can ask your question at the comment section. I'll be glad to answer your question. If you have anything that is confusing you, you can ask any of your question there. I will answer you. So thank you so much for staying with me to the end of this video. If you find this video interesting, please click on the subscribe button, subscribe to my YouTube channel, share to your friends, and also turn on your notification bell so that each time I upload a new video, you'll be among the first to be notified. So thank you so much, guys. Have a nice day. Bye.